So we have a connection error. We are trying to resolve it. Let's see. So let us take up another remedy from the Allen's keynotes. The remedy which is the most important as a building block for all the children, and we should give like a routine prescription. Generally, routine prescriptions are kind of a strict no-no because we stick to individualization. But in cases of children and in cases of old age, there will be remedies that will have to be given based upon the presenting symptoms, which will be mostly common symptoms, and the the presentation of the symptoms will be such that it will fit into those, that this specific remedy from those particular group of people. It can be children, it can be old age, but we are considering children right now. So this is one of the important remedy for children, and we will have to give it routinely, especially in small age. The remedy is calcarea phos. But in our materia medica, we can't say that there is a remedy which works specifically on children or specifically on certain age group. We can increase its work or sphere of action in the larger age groups, which is what it is uh, you know the correct homeopathy will be. So the first line what Allen says about calcarea phos is ailments from grief, disappointed love, and you see the mention of the other remedies, aurum, ignatia, phosphoric acid. We have often given these remedies, ignatia, phosphoric acid, aurum, etc., in cases of grief. But interestingly, calcarea phos is never prescribed for grief, and you will have to give it in cases of grief, especially where there is sighing while talking. This is the complaint which you will need to observe. This is the observation which you will need to do in your clinic. Involuntary sighing. If you go and read Boric, you will find this involuntary sighing very well written. Over here, there is just one line about ailments from grief and disappointed love. You can just remember it. We keep on collecting data from different materia medica books for our prescription, and that's the best way to understand a remedy, by reading through different materia medica books. For persons anemic and dark complexioned, dark hair and eyes, thin spare subjects instead of fat. So everyone in your clinic, you must have seen an individual, especially a child who is taller than his age. We read this also in creosote. Taller than his age, or someone who is growing rapidly, the bones are growing rapidly, the child is the tallest in the entire class. Amongst the siblings, he is the tallest even though he is the youngest. This will be the ground for prescribing calcarea phos. Girls at puberty, tall, growing rapidly, tendency of bones to soften and the spine to curve. Theridion is one of the other remedy, and calcarea phos is the remedy which we are discussing. Feels complaints more when thinking about them. Often patients will tell you that my headache, once I start thinking about my headache, my complaint increases. Once I start thinking about my pain in stomach, my complaint increases. Often you will have children in your clinics who will have psychosomatic pains. They will have pains because someone has shouted upon them, someone has rebuked them, and the pain will be localized in a body part. It can be legs, it can be hands. Whenever their siblings or their parents will remind them, "Arey, how is your pain right now? Can you tell me?" And then you will have that pain starts, and ends after a few hours, and every day it keeps on happening. When the patient is reminded of the pain, if he is not reminded, it does not happen. This is the way you will be able to treat psychosomatic cases. There are other ways I have discussed in one of the videos I'll be putting up very soon, about how you can unlock psychosomatic complaints in children's. Very tricky thing, but most common thing that we need to undertake and cure, because the allopathics have no medicine for these type of presenting complaints. Helonias and oxalic acid are the other two remedies which we see for complaints aggravate when thinking of them. Calcarea phos also should be remembered. Involuntary sighing, you see this mentioned in physical general, but it is in connection with the grief element which is there in the first line of calcarea phos mentioned. Ignatia is the other remedy for involuntary sighing. Calcarea phos is mentioned over here. Rheumatism of cold weather, getting well in spring and returning in autumn. So you'll have many patients who will tell you that in the cold weather, in fact in near repertory or Kent repertory, there is only single remedy, calcarea phos, for pain aggravated in cold weather or wet cold weather, and then the rheumatic type of pain will be mostly aggravated and get better in summer or other seasons. This remedy can be thought. I have prescribed it many times in such patients. Now there is a special thing over here, and as we discussed, it is a remedy we give to children during the first and second dentition of scrofulous children. Diarrhea and great flatulence, children are emaciated, unable to stand, slow in learning to walk. Calcarea, carb and silica are the other two remedies. Sunken and flabby abdomen. So all the children who are lean, thin fellows, who have teething troubles, who are slow in learning to walk or stand, they should be given calcarea phos. It is one of the building blocks for the body. Calcium and phosphorus components being important elements in this remedy, and this remedy will do wonders. You can give of infants, oozing of bloody fluid from navel of infant of the umbilical cord, and we need to give this remedy if there is oozing of blood which is constantly happening. There is no stopping in spite of giving all of allopathic medicines or hyoscyamus. Very interesting. We'll have to go to the source book and see how this symptom has appeared. Is it a toxicology symptom? Is it a proving symptom? And we'll be able to find out what conditions we'll be able to prescribe in such a case, hyoscyamus, which is mentioned. Next you have is at puberty, acne in anemic girls with vertex headache and flatulent dyspepsia, better by eating. Many times patients will tell you that I'm having a lot of gas, but if I eat something, I feel really better. That is where we should think of calcarea phos. We should not beat around the bush. Gastric disorders should be commonly handled by every homeopathic distresses, GERD. All these complaints are precursor to the later stages of development of gastric troubles which linger for years and years. If we are able to arrest them right in the beginning, there is a possibility that you will avoid the major disaster happening to the patient. Next you have is that in children there is cranial bones which are thin and brittle, racheitis. Fontanelles and sutures remain open for long or close and reopen, delayed or complicated teething. So many times we have this senior practitioners telling that anterior fontanelles calcarea phos, posterior fontanelles calcarea, anterior fontanelles is calcarea carb, and posterior fontanelles is calcarea phos. You can consider it, but here there is nothing mentioned as such. But if the fontanelles remain open for a long time, much after the due date, then calcarea phos as a remedy can be prescribed. Calcarea carb also can be prescribed. The idea is to prescribe either of these building blocks, calcium carb or calcium phosphorus, depending upon the physical particulars which will be present. Here it will be a lean thin fellow, there will be a fat flabby fellow. It can be thin, but the perspiration will be mostly on the head, scalp, and also diarrhea. So all the people who land in your clinic in the age of 18 to 30 years, they will be having a lot of diarrhea. college going young teenagers who have headache, they should be given this medicine, natromur and sorainum, the other differential medicines. Along with this, there will also be element of diarrhea or element of loose stools which will continue in these class of patients. Now comes very interesting symptom, and this is the symptom that you will be curing a lot of gastric acid peptic disorders. And the symptom is, at every attempt to eat, there is colicky pain in the abdomen. So many times patients will tell you that there is lot of irritations, lot of acidity, hyperacidity, burning in the stomach, but as soon as I eat, I feel that the pain has increased and I cannot control and I get restless with the pain. That is where we should think of uh, calcarea phos. Many times children will complain that we don't want to eat further because there is a lot of pain, or the mothers will tell you that the children are complaining that they don't eat because they just tell that after eating they started having stomach pain. I don't know what's happening. Calcarea phos will set things right if you give in 200 or 30 potency 3 times a day for 1 week or 2 weeks. Next comes an interesting symptom, which is one of the very toughest things to find in clinical practice: fistula in ano alternating with chest symptoms. Now, many times you will have patients who land to you in cases of fistula in ano, and they will tell you that in their past history, 3 months ago, they had respiratory tract infection, cough, fever, viral infection, etc., etc. And now suddenly, after a few months, they have developed this complaint. Is it due to sedentary work? Is it due to their lifestyle? They don't know. But this is sufficient for you to prescribe calcarea phos, fistula in ano, alternating with chest symptoms. Berberis is another remedy mentioned. Lack of animal heat, patient is always chilly, cold sweat, and general coldness of the body. So this is one instance of detecting fistula in ano alternating with chest symptoms. Alternating symptoms per se are very difficult to elicit in our clinical practice because they are a kind of very tricky in nature. You will not understand what comes before, what comes after, and what to pick up from the presenting symptoms as an alternating symptom. But if you are well conversant with materia medica, different books, you will be able to pick it up very easily. Next you have is spine weak in calcarea phos, disposed to curvatures, especially to the left, unable to support the body, neck is weak, unable to support the head. Abrotanum, the first remedy that we started in 11th June for Allen's keynotes, has this mention of unable to support the head. And now we come back to the same symptom after 3 to 4 months. So some things will keep on repeating in the materia medica, and it's good to see a repetition because it revises what all were the other remedies which were unable to support the head. Ethusa was one of them, abrotanum is one of them, you will see silica one of them, sanicula one of them. So in this way, once you collect all these remedies, it's going to be a marvelous work of knowledge that will be at play when you will be in your clinic, seeing the patients and trying to understand what they are telling and how to find in the books. It's going to be a beautiful journey if you are a passionate homeopath. Next you have is non-union of bones promotes callus. Symphytum is other remedy. So all cases of fractures or cases where there is a lot of injury, symphytum and calcarea phos can work in a kind of a harmony if you give them in alternation, or there can be a possibility to give these medicines one day and the other day the other medicine. This also can be a possibility. You have to explore all the possibilities which will give you an opportunity to learn. So next you have is exposure to damp, cold weather, changeable weather, east winds, melting snow, and mental exertion, which are aggravation for calcarea phos. And amelioration is summer, warm and dry atmosphere. Calcarea carb, fluoric acid, kali phos, and also to sorainum in debility remaining after acute diseases. So there is an interesting rubric in Boger Synoptiki which I always refer. It's a very small rubric, I am having only 3 remedies. There is weakness after acute diseases, exhausting diseases. Sorinum, China, and Veratrum are the three remedies mentioned. Calcarea phos comes as an addition from Allen's keynotes, and it's going to help you in such cases where there has been lot of debility after the acute diseases. You can think of carbo animalis also as one of the remedies. If the patient is chilly, think of carbo animalis. If the patient is hot, think of carbo veg. So Dr. Sanawar Ali, acne in anemic girls. Yes, so this is a very nice remedy for acne in anemic girls. I'm sure you, if you have prescribed, you are telling about this symptom. If you have not prescribed and just observe this symptom, it's going to be a good, marked symptom for prescribing this remedy. So good to share, Dr. Sanawar Ali, and good to see you are active. And we are here with relationships of calcarea phos. This remedy is similar to sorinum as we discussed in debility after acute diseases and to silicia, but in silica there is lot of sweating of the head, whereas here there is lack of sweating of the head. There will be general coldness. We already read that there is lack of animal heat and cold sweat, general coldness of body. This is mentioned in gastrointestinal symptom, but it applies to the remedy in general also. uh, where will you give calcarea phos? You can give this remedy especially in children as a building block, dentition cases. In cases of grief where there is involuntary sighing, there is mention of this remedy for involuntary sighing, and there is other component is ailments from grief and disappointed love. Aurum, ignatia and phosphoric acid are mentioned. And wherever the complaints are aggravated when thinking of it, you see that there is also interesting symptom in children. You will see psychosomatic pains, that there is pain in the abdomen as soon as the first bite is taken. Very keen observation you will do. This remedy will work best before iodum, sorinum, saniculus, sulfur, and if it works well after arsenic, iodum, and tuberculinum, it will work best after those remedies. So what are the chest symptoms of calcarea phos? Please have a look. So yes, so I spoke about few uh, chest symptoms, and in the Allen I am discussing per Allen only per se, but there is a mention of just the general child symptoms and gastrointestinal symptoms or head symptoms, but nothing else except for the rheumatic pains which get aggravated from the cold weather exposure. So in this way you can make your own understanding about this remedy and prescribe in such cases where you feel that it is cold weather, joint complaints are aggravated, chest pains are aggravated, and so on and so forth. And fistula and NO alternates with chest complaints, as I discussed already. If you have joined later on, go back to the video and watch it again, just 15-20 minutes of recap. But this remedy is going to be a very helpful prescription for you all to prescribe in children cases and in different cases of fistula and NO and involuntary sign, especially in cases of grief. So that's all from today's session, and I hope you all are studying Allen's keynotes alongside and building your own study of this remedy. So we'll see again tomorrow another set of remedies picked up from Allen's keynotes. We are done with 80% of the Allen's keynotes, and there are just a few remedies left, like a few acids and metals and bowel nosodes. So we'll soon come to it, and hope you all have a good study of Allen's keynotes to master this book, and then we'll take up the next book for mastering in our from our materia medica.